Hello guys, so welcome to my channel. Today, just as I said, I'm going to talk about Tumbu fly. I told a backstory that recently I saw a patient who had a wound, and observing the wound, it had some tiny small holes in it. Then that gave me the motivation to search more about it, and I also asked my seniors, and they told me about this disease called, or this fly called Tumbu fly. So today I'm going to present to you about Tumbu fly. So stay tuned to the end. Tumbu fly is a species of blowfly found in East and Central Africa. It is a parasite of large mammals during its larva stage. Its larvae can burrow under the skin of mammals including people and pests like dogs. They live under the skin until they become mature into adults and burst out of the skin. So these flies have several names including pussy fly, skin maggot fly, and tumbu fly. So the larvae of mango fly are parasitic. This means they get under the skin of mammals, including the humans, and live there until they are ready to hatch into maggots. So, this type of parasitic infestation in people is called cutaneous biasis. So, now we're going to talk about how mango fly get under the skin. Female mango fly lay their eggs in dirty clothes and sand that carries the scent of urine. They may also lay their eggs on beddings, towels, and other soft material that have been left outdoors. So items that smell of sweat also attract mango fly, but washcloths can also attract them. Mango flies are very tiny. The naked eye usually can't see them. Once laid, they hatch into larvae. Their next step is growth. The process usually takes place around 3 days. Larvae from the hatched eggs crawl under the skin and grow. Larvae can survive without a host up to 2 weeks. Once the larva makes contact with the mammalian host, the painless burrow under the skin. They painlessly burrow under the skin. Once under the skin, the larva feeds on subcutaneous living tissue for 2 to 3 weeks as they continue to grow. During this time, a red solid boil with a hole or tiny black dot on top will form and grow. Each boil contains one maggot worm. The same thing I told you. So this patient which I saw, the first patient, not the one I talked to you about yesterday, but there's a previous patient which I ever saw who came in the night, and he had the wound in the leg. So the wound around, the place around the wound, surrounding the wound was so hard. So I had to press it, and imagine what came out of the wound. It was a warm kind of a maggot. So that's what normally happens. It has a hole, and each boil contains one maggot worm. Adult maggot bursts out of the boil in the skin. As the larva continues to mature into adult maggots, the boil will start to fill with pus. It may be possible to see or feel the larva wiggling under the skin during this time. When larvae are fully matured, they burst out of the skin and fall off. As fully formed maggots, they continue to grow into maggot fly over a 3-week period. I hope you enjoy it. So, when the 3-day period has ended and the larva is under the skin, they form pus in the area around the skin, and they burst out of the skin because now they will have grown, and now they are waiting to grow into a maggot fly. So, signs and symptoms: there's some intense itching, kujikuna, discomfort and pain, of course, in the area, blister-like lesions, yeah, redness, of course, sensation under the skin, then fever. So this fly wound might require removal of that larva. So removal of mango fly larva from under the skin might be done using different methods. There's this one called hydraulic expansion, which is injecting each boil with liquid. I know this for the medics, but if you go to the hospital, they can do this procedure called hydraulic expansion, where they inject some type of fluid which ni ya kugandisha, especially wale wenye huwa wanaendea sindano ya family planning. Huwa hiyo sindano hiyo na wanawekea ndo usisikia uchungu, hiyo ndo wanatumia kwa hii kidonda kaa hii. Ndo inaitwa hydraulic expansion. The process of using this drug to kugandisha your area is called hydraulic expansion. So in most cases, the force of the fluid which they will use that area will push the larva into out completely. So in some cases, the larva will need to be lifted out with forceps. So if the larva is not coming out easily, the doctor might use a piece of forceps to pull it out. So number 2, the suffocation and pressure. The removal of scum. The covering on top of that boil is removed, and that appears on the top of the lesion, the cover that appears on the top of the lesion is removed, then you might be able to rub it off with oil. So oil, what does oil help here? Oil help to suffocate the larva. So to cut off the oil, now they're trying to explain. To cut off the larva's air supply, you can cover the black clot on top of the boil with petroleum jelly, or you can use petroleum jelly or wax. The larva will start to crawl out and seek for air. The larva will crawl out itself, and at this point you can remove it by a piece of forceps. Ikitokea tukidogo imetokea unaivuruta na forceps. So until then, I have no much to say but saying goodbye. If you have any question, please don't be afraid to ask me in the comment section, or you can also slide in the DMs. And also, if you want to collaborate, please follow